Hi there, and welcome to Mayo Clinic in Florida's pre-op holding area. Once you are checked in and we are ready to prepare you for surgery, one of us will come get you from the surgery waiting room. As a safety check, we will ask you your name and date of birth, and we may verify that your valuables have been secured. This is the time to give hugs and kisses to your family and friends who have accompanied you. We will assure them that we will take very good care of you. Because of privacy concerns regarding other patients, we regret that we cannot allow your family and friends to accompany you into the pre-op holding area. Although your family and friends will not see you again until you get to your hospital room, our tracking board and volunteers will keep them posted on your progress, and your surgeon will speak with them after your surgery is completed. We ask your family and friends to notify our volunteers if they leave the waiting room. We want to be able to contact them as needed to update them on your progress. We know your loved ones may be a bit anxious about you having surgery and want to decrease that anxiety through excellent communication. As we walk into the pre-op holding area, you'll be asked if you need to use the restroom. Don't worry if you do not feel the need at this time. There will be other opportunities. Next is everyone's favorite, the scale. Here we will measure your height, weight, and temperature. Then you will be escorted to a bay. We will give you the Sage pre-op skin wipes that you read about at check-in. Don't worry, we are happy to help you if needed, and we will wipe your back. Remember, the skin cleansing process is done to make your surgery safer, namely to decrease the risk of an infection with the procedure. We will give you a very stylish hospital gown that is worn open in the back. We will ask you to remove everything but your smile, place your clothing and shoes in the belongings bag, put the gown on, and have a seat on the stretcher. Someone will bring you a warm blanket for comfort. At this point, there may be many people working around you to get things ready. You'll be hooked up to monitors that will measure your blood pressure, heart rate, breathing, and oxygen saturation. The preoperative nurse will begin to perform additional safety measures by asking you a series of questions. The first of which is, you guessed it, your name and date of birth. The nurse will also inquire about your allergies, health history, medications, how you learn best, and if you have any open wounds. He or she will also begin teaching you about what you can expect immediately after surgery. After surgery, most people don't want to take deep breaths, cough, or move because it hurts. We will be managing your pain accordingly so that you can perform these functions to avoid complications such as pneumonia and blood clots. So remember to deep breathe, cough, and move. At the same time you are talking with the preoperative nurse, a patient care technician will probably scrub and clip any hair around your operative site. We like to refer to them as your barber. We use a clipper instead of a razor, as clipping is better than shaving to reduce the risk of infection. We are constantly focused on how to provide you the safest care. The tech will also place a thigh-high stocking on the leg that is not undergoing surgery. The compression stocking is important to help prevent blood clot formation. We know that no one is a big fan of needles, but we do need to start an IV in the pre-op holding area. With this IV, you'll be given medications during surgery. The pre-op nurse will use a bit of numbing medication first, just like the dentist uses, to make the IV placement as painless as possible. Fluids will be hung and administered at a slow rate while you wait for surgery. What goes in, though, must come out. So if you need to use the restroom, no worries, one of the staff will be happy to assist you. Once the pre-op staff has completed their tasks, you will be given a call bell in case you need any assistance while you wait. Other people will come by to see you, including your surgeon, various members of the anesthesia team, as well as your operating room nurse. As a safety step, the surgeon will mark the site that will be operated on. Others may ask you some of the same questions you've already answered today. Again, this is not a test, but we feel that the more information is shared about you, the better we can take care of you. Now you are ready for the next leg of your journey, the operating room.